Hi, my name's Chris. I'm a prosthetist here at Integrity Prosthetics and Orthotics, and today we're going to be discussing how to don and doff a prosthesis. So every patient that leaves our office will leave with a donning and doffing procedure pamphlet. So this is going to just give you a step-by-step picture guide on how to properly don and doff the prosthesis. So if you can't figure it out, resort to this. If that doesn't work, just give us a call and we can definitely walk you through it. So we've got a below the knee prosthesis here. So in order to put this on, this is a suction suspension system. So with a suction suspension system, we're going to have an outer sleeve. Now, putting the sleeve on is one of the more difficult things that I have patients ask me how to do. So there is a wider side and there's a more narrow side. Now we're going to take the narrow side, we're going to turn it inside out, and we're going to roll it down about 1/3 of the way. So now you have 1/3 of the gel showing, just like this. We're going to take this, we're going to turn it inside out, we're going to set it on top of the prosthesis. Then we're going to take with the palms of our hand and just roll it down, just like so. So that way now you have the wide part of the suspension sleeve at the top. We're going to take that suspension sleeve, we're going to turn it inside out, and we're just going to roll it down. Now the fabric on the inside is allowing us to roll it down. If the gel was on the inside, it would not allow us to do it, it would just stick to itself. One key thing we want to keep an eye on back here is when we do roll it down, we want to make sure that this gel clears this posterior brim back here. Otherwise, if that gel does slide in there, when you go to don the prosthesis, that gel will slide into the socket and it will cause some skin irritation or maybe some skin breakdown. So now that we've got the sleeve on the prosthesis, we're going to set that aside. And I've got my residual limb mannequin here. So every patient will get a liner with the prosthesis. We're going to take that liner and we're going to turn it inside out. Now there are several different liner manufacturers, so if your liner doesn't look like this, that's fine. We're just going to use this liner today, for instance. Okay, now that we have the liner turned inside out, we don't want to cheat and cup the bottom of the liner because we'll trap air in the bottom between the limb and the liner, and that again will pull some blisters. We turn it inside out, we want the bottom of this to touch the bottom of that limb. So we're going to take that and we're just going to push it up, and it's just going to fall on itself just like that. So now that we have the liner applied properly, we're going to take the limb and we're going to push the limb down into the prosthesis to a certain point, and then where we can't go any further. And then whenever you're weight bearing would be best, we're going to take the sleeve and we're going to pull the sleeve up on the leg just like this. And keep in mind, we want at least 4 inches of this sleeve touching the limb or the thigh. Otherwise, you could possibly lose suction. So then to take it off, we're going to take the sleeve, we're going to roll it back down the leg, and then we're just going to step right out of it. So now that you stepped out of the prosthesis, in order to take the liner off, we're just going to take the liner and we're just going to pull it off, just like so. Now, if you want to wash the liner, you can wash it. I recommend washing it with some mild soap and detergent. You're just going to turn it inside out, put your hand on the inside of it, take some soap, and you're just going to wash it down, and then set it aside to let it air dry. Now, to take the sleeve off, to wash the sleeve, we're going to take and we're going to pull it down the rest of the way, so that way now the sleeve or the fabric is touching the prosthesis itself. So then all you have to do is just pull the sleeve up on the prosthesis, just like so. So that's how to don and doff a prosthesis. If you can't figure it out or have any questions, feel free to give us a call or text us at 863-937-9200. Thank you.